everyone. My name is Dr. Joe Goldberg. I'm a clinical professor of psychiatry at the Icahn School of Medicine in Mount Sinai in New York. And we're here today talking about post-traumatic stress disorder, or PTSD. We're going to take a few moments to talk about screening for PTSD. So why is early detection important? PTSD is an overlearned abnormal brain response to a severe traumatic event that occurs in people that have this biological vulnerability to develop really this overlearned response that involves hyperarousal, re-experiencing, reliving of the event, avoidant behaviors, nightmares, flashbacks, mood symptoms, cognitive symptoms. So recognizing it when it's there is of critical importance, not dismissing it and saying, well, anybody would have PTSD from a trauma. No. It's a brain disease. It's a brain disorder in response to trauma. So accurate diagnosis is important. If someone's going to be screened for post-traumatic stress disorder by a healthcare professional, it means having questions asked that often are very delicate. So one hopes that the healthcare professional exercises a sense of discretion and sensitivity and great empathy in knowing when someone has experienced some traumatic event. A patient might volunteer this information. They might say that I was the victim of an assault or an attack, or a survivor of a traumatic event or of abuse. So this may then lead to a series of questions. So it's helpful if the clinician asks permission to ask questions. Would it be all right with you if I ask questions about what happened? And if anything I ask you is uncomfortable, please let me know. The same way if a clinician was doing a physical exam, they'd hopefully also say, I don't want to make you uncomfortable, but I like to gather some information so I can be of help to you. So the role here is to be able to provide as much genuine information as one can. And in some ways, the details of the event are important, but even more important is the response to the event. So the kinds of questions that someone might be asked may revolve around having a lot of trouble sleeping, a lot of restlessness or nightmares or insomnia. Do you find that you're having moments where you get very irritable out of the blue for no particular reason, or you startle very easily? Do you find that if you're thinking about an event that was very upsetting to you, that it's hard to remember the details? You could get kind of fuzzy about that. Do you find you ruminate a lot about something that happened? So a good inquirer or interviewer will be very attuned to that and ask about, do these symptoms get in the way of your functioning? And not just say things like, so you're having trouble sleeping, let's give you a sleeping pill. Or even to say, well, you sound depressed, let's give you a depression. But to go a little farther and recognize that if a traumatic event or persistence of events, there could be persistent abuse, persistent trauma, leaves its mark, takes its toll, it's its own diagnosis, requires its own treatment. There are screening tools that clinicians sometimes use. One that's commonly used is something that goes by the name of the PCL-5. That's a 20-item questionnaire or checklist that's gone over. There's another scale called the Clinician Administered Rating Scale for PTSD called the CAPS. Those details are not as important as just knowing that the kinds of questions a sensitive clinician will ask are there to really elicit the history that will point to this is not just a traumatic event. It's left a mark, and if we don't treat it properly, it could persist onward, which happens in some subgroup of people with PTSD. These re-experiencing, reliving symptoms can go on. And if they go unchecked and untreated, it just makes it much more harder to function. We often think also about people that are especially high risk for PTSD. That could be combat veterans, first responders to traumatic events, trauma survivors, survivors of natural disasters that might have occurred. So if something like that has been, well, in someone's history, first questions are about, have you experienced a traumatic event? Cast the wide net when you're thinking about this. Well, it wasn't traumatic for me. It might be for somebody else. Everyone is unique. Everyone is different. One size fits one. So when we're thinking about the sequelae or the aftermath of traumatic events on these various levels of brain functioning and emotional processing, we want to have a very open mind to understand what's going on so that the treatment can be tailored to the patient, be appropriate, effective, and ameliorative.